understood the basics of human anatomy, human physiology, understood the difference of what these two terms mean, and also understood the importance of nutrition in the first 6 chapters. And of course, that was Riddhi Shah uh, with a lot of detailing, and we went past 12. So if some of you have not attended the class, the recording is there on your member section. So please go through it and then ensure that you are in alignment with what's going to happen today. So today we are going to be talking about the another 6 chapters of this section 2, which will be the fundamentals of nutrition. Now, thank you for acknowledging that that was a very informative video of Deepak Chopra, the spiritual guru or spiritual trainer, whatever you want to call it, call him. And B.M. Hegde, Dr. B.M. Hegde is now known in the medical circle, in the health and wellness circle, as a kind of a rebellion from the conventional wisdom of medicine. And in this video, he actually very clearly says, as to, when the doctors go on strike, the people become healthier. That's the takeaway. So that precisely means that the prescriptive medicine that people today are over dependent on is silently killing people. So that's the reason the Edwards drug reactions today are that is the #1 cause of death. Even the Indian audit report on the pharma companies and the hospitals actually reveals that 60% of the surgeries could have been avoided because that was not required. There are alternative methods, and that's one of the reasons why a lot of medical doctors who have now gone beyond the commercial accomplishments that they have that they want to do, they've gone beyond that, and then they have now a very liberal and social outlook, are now coming out of this medical system and then advocating people by saying that you got to be with the nature. So one of the things that Dr. B.M. Hegde also tells that, when there is a prescription medicine that's given, there's a very, very small amount of data that's considered to decide as to what's the prescription that's relevant for you. So, genetics or nutrigenomics comes with a lot of disruptive philosophy or, kind of insights that the general world may resist accepting at the initial stage, simply because we're all programmed. We're all programmed to say that, look, get a disease first and then go for the treatment. Now, the pharma industry or the current medicinal system is working on a pattern which is not which is not working. Otherwise, people wouldn't die in large numbers, which we call as pre-medical death. Now, there's a little news that's coming regarding the ex-Prime Minister of Pakistan, that some reports already said that, he's already passed away. But then there are the family members and the other people saying that, look, he's struggling. His case is irreversible. It's not, there's no cure. So what happens to this person who has, so much of a fame, so much of wealth, so much of influence? So he's not been able to do. So I think there's something beyond that we need to be doing. So in this context, friends, and the students of this batch, that genetics comes with a lot of promise, a lot of insights. Yeah, so both the books that you mentioned, Maria and Abhijit, are very, very relevant to what we are understanding, because these books are written by medical doctors, and that's very important. It's not written by people like who are non-medical doctors. So they know, it's like, they've been there and done that. They know what's really happening. And in my interaction with a lot of medical doctors in the last 5 years, the kind of conversation that they have with me and reveal a bit of inside stories, it's shocking. It's very scary, because something happens to you, they'll treat you as a commodity or treat you as a piece of flesh that needs to be cut, paste, and whatever. So there's nothing else that we're looking at. So my request is that please be attentive and then ensure that what we are trying to teach in the CCNG class is percolated down with at least health conscious individuals. There could be healthy debates that we could do, And sometimes it might get into a bit of argument also, because people tend to put forward their philosophy, which that people will be practicing for so long. So be the instruments of that message that we can take down to people. So we come back to what's going to happen. So we'll continue with what we did last week. So we're going to continue about a lot of different kinds of nutrition that can come into the rescue of people.
On an average, women need to consume somewhere around 2 liters baseline level, and men need to at least have 2.5 liters per day. But now, why am I saying in terms of weight is you need 34 ml per kg of your body weight. So you multiply by 34 ml, you get the average water intake that you need as per your body. Now, this is an average number that 70% of our body contains water. It could differ from person to person, of course, height, weight, overall body circumference, any health issues that you all have. So the water, how much your body holds water, it changes as per different scenarios. But on an average, 70% of your body contains water. And is it just free flowing in your blood? No, all of your organs contain some amount of water in order to keep it going. So regular intake of water is necessary to maintain water balance. But why exactly that is required? You all can see the videos later on, of course, all of them are related to that. But like I said, minimum recommended water intake for women is 2 liters, but for men is 2.5 liters. But go as per your weight, that is more accurate. Now, do you all think if we drink more water, we'll gain weight? This is a common myth and it's asked by a lot of people. So they think by drinking a lot of water, your body is going to hold that much water. Is that true? And if you think it is true, under what circumstances? Okay, so all of you agree with the fact that you won't gain weight because of drinking water, right? Under what circumstances does your water accumulate in the body? Does anyone know? There is just one instance when your body will start holding water. There's one organ system that is responsible for maintaining that. Kidneys? Is it right? Absolutely. So your kidneys are responsible. Now, when your body's kidneys are not filtering out, the substances properly, and especially when a person has hypertension and that leads to kidney related issues, your body starts to hold water, and there is a term for that. Does anyone know it? Yes, kidney dysfunction. Correct, Sumit sir. So does anyone here know what is that condition when your body starts holding a lot of water? When you press your hand and there is a dent or an indentation, okay, when it takes a longer time to come up, it's called edema. Okay, so that is when your body is going to hold more water, and that is an issue, and you cannot have a lot of water in only in that condition. But otherwise your water intake needs to be 34 ml per kg body weight. And why is that? Your body is very brilliant. The amount of water you consume is going to be exactly equal to the amount of water you throw out of your body. Now, there are various ways, right, by which you are going to excrete water. Can you all tell me any ways by which your body excretes water? How does your body excrete water? Sweating, urine, sweat, yes, sweat, urinating, any other? So your skin is one of the ways, yes, urination, yes. Okay, any form of excretion does expel out water, including sweating as well through the skin. Now, when it comes to your body, this is how it's divided. When we say on an average, 70% your body is made of water, but when you look at every system, when it works on water, try and correlate it to the importance of those systems and what will happen if that particular organ system does not get the amount of water that it needs. For example, your kidneys are the main system for excretion, right? They are responsible for maintaining electrolyte balance. So 83% of your kidney systems, it's made of water. Your heart, cardiovascular system that keeps your heart beating, 79%. This is made of water. Your brain, your neurological system, 75%, right? And your brain cells are the ones that do not regenerate. So here, your cells of your brain, they also require water in order to sustain. Then your liver, you just have one, right? Your liver is the place that bears the brunt. It has more than 200 roles that it plays, right? It is a place that also produces cholesterol. And also your liver is the place that helps in detoxifying your system. Your kidney, liver, and your skin are the three main detoxifying systems. So this also contains 86, almost equal to your kidneys. Your skin, 64%. Your blood, right, which is the major fluid in your body, so that contains 83%. Your bones, even your bones, imagine, now we cannot correlate that because we don't think of fluid except for the synovial fluid that it contains, that is responsible for lubrication. Varna kya ho jata hai? There's friction, chances of osteoarthritis or any bone related conditions. So here your bones contain 22%. Then your muscles hold water, all of you know that, right? So this is just responsible because protein holds water. Your muscles are majorly made of proteins, which is why 75% of your muscles hold water. Then you have lungs, about 80%, joints, 83%. Then you have lymph. What is lymph a part of? Come on. Does it increase linearly or is it certain stages? Number two, more in certain stages? Answer lock kar diya jaye, because this is maximum what I'm getting, and all of you, the ones who have answered number two, is correct, because there are certain stages in our life that require more influx of nutrients, especially certain nutrients. Nevertheless, every stage is important and every stage is marked by certain, maybe kuch nutrients thode zyada chahiye rehte hain, maybe other nutrients can be taken at a lesser. Now, there are, some of you mentioned pregnancy, which is one of the important stages. Then you have lactation. Then you have infancy, right? When a child is born. So now we are going to go stage by stage and understand what exactly is done in those stages. Although we are not going to go by each and every nutrient, how much needs to be taken, that all of you can see there are very many tables given in every stage. So you can see how much iron is needed, protein is needed, etc., etc. We are going to focus on why exactly those nutrients are important and what exactly happens in each of these stages. Okay, so now let's start with infancy. Matlab, when the children are born. Now, infancy is a period of rapid growth. Why is it called a period of rapid growth? Now, after pregnancy, after a mother gives birth to a child, when the child is in the stomach or in the womb, the child is completely dependent on the mother's, are very paramount and important. So teenage eating habits, since they are influenced by their peers and other influences, extra care needs to be taken, because around this time in teenagehood, children are also carried away by image. Okay, if you're aware of something called eating disorders, anorexia, bulimia, etc., it usually shows up in teenagehood, where whether it's girls or boys, like boys at this age, they want to make six-pack abs and all of that. And, women want to maintain a certain figure. Regardless, right now, things are more open and parents tend to talk with children about it, because this is very important. If they get carried away by it, eating disorders is one of the genes that we test in our reports. It is rampant, and as many counselings as I have done, the girls, especially if they're 15 and 16, and when I talk about eating disorders in front of the parents, they may not say much, but then what they tell me, that I do experience periods where I don't want to eat at all because I want to lose weight. So these are the starting psychological cues that you need to take, that your child is actually having bad eating habits, and this is something that can lead to psychological issues later on. So during this time, psychological, social, and physical health is very, very important, and parents need to be in constant communication with children in order to make sure what exactly are they consuming. Now, how much calories do they require? At this stage, the amount of calories they need is probably more than what even we need at this age. So if you see, boys require an additional more than usual, men of our age right now, they require 2200 to 2800 calories per day in order to support that growth spurt, because teenagehood, they tend to grow faster. In fact, girls grow faster when they are teenagers. Boys may look of the same height as girls when they're teenagers, but then boys suddenly have a growth spurt after that. Okay, so during this time, girls and boys both require a high amount of calories and nutrients. Okay, so the nutrients that they require is usually consistent. Abhi agar hum protein ke hisab se, it's as per our physical activity. It will be anywhere between 1 to 1.2 gram per kg body weight. But when it comes to boys, it is usually consistent, where boys need 52 grams, because we are calculating as per their average height for boys that are teenagers. And for girls, it's 46 grams per kg body weight. But now think about how much protein are we actually consuming. Because when you take one whole egg, it contains just 7 grams of protein. If you take 100 grams of chicken, it contains 20 grams. But now imagine how much protein are you actually consuming? How much protein are you giving your children? Okay, so now what deviate from your regular routine? So this is the most healthy way of approaching your adult related food. Now, these aging processes, since they bring about physiological changes, they also inadvertently they cause social and psychological changes too. As much as we liked to socialize when we were teenagers or maybe in our 20s, by the time we cross our 30s, we become more of a less social and more of a to ourselves person, psychologically and socially as well. Because during this time, there is more of work pressure. We think more of the future, savings, having a settled life. So during this time, there is an altered change or a perception towards our diet as well. So now around this time, our functional capacity also tends to deplete. But by making sure that you are exercising, we have seen examples of people even at 80 running marathons. Even at the age of 90, people have had COVID and they have come out of it. Why could it happen? Why is it that probably, sadly, a 40-year-old succumbed to it, but a 90-year-old was able to come out of it? It is the foundation that you build for yourself right from scratch. So even if as a child you may have had deficiencies, if you reach an adulthood and if you're knowledgeable about it, you can still take care of it. Now there are different systems in our body that actually bear the brunt. One of them, of course, is gastrointestinal health, but also our liver. So around this age, especially people who consume alcohol, even if it is occasionally, since our medicines, if you are unwell in adulthood, we tend to take supplements also. We tend to take medicines also. So that affects affects your liver, right? So detoxifying your liver, detoxifying your kidneys is very, very important around this stage. Now, just because we have, we undergo these physiological changes, there is an increased requirement of supplements. Now, I don't want you to think that supplements is the end all be all or it is required for you. But because of our erratic schedules and because our appetite tends to go down around this age, we are not at that age where we tend to want to eat all the time or eat different foods all the time. So during this time, when our diet becomes erratic and we are not able to compensate for that lack, because RDA to RDA रहेगा. अब आपको जितना iron चाहिए आज, just because your age has increased does not mean the ICMR or WHO standards are going to say ठीक है जितना iron चाहिए आप ले सकते हो. No, right? You need the requirement daily intake. You have to meet it by hook or by crook. So is age पे, when you know that your diet is not able to provide for that, you need to take it via supplements. वरना क्या हो जाता है? You end up with deficiencies, and deficiencies is the least of your problems. The consequences of deficiencies is the more, pressing issue over here. Because when we talk about major nutrient deficiencies like vitamin D, we know that it affects bone health, but it will also affect, it can, pressing issue over here. Because when we talk about major nutrient deficiencies like vitamin D, we know that it affects bone health, but it will also affect, it can trigger diabetes, it will affect your liver health, your kidney health, your heart health, it can cause osteoporosis, absolutely. So these are cumulative consequences of something that we tend to just brush aside. Just yesterday, one of my clients told me, now this person has vitamin B12 is very low. Vitamin D is in a single digit. And abhi bhi the person is asking, tell me through food now what I can take instead of supplements. Now imagine, you cannot compensate a deficiency through food. You need to think of it that way. अगर खाने से ही आप maintain भी नहीं कर पाओ, तो बिना supplement के आप, how can you fill that lacunae of deficiency? Now this person has already started issues with bone, with blood sugar, with everything. So what is the way by which you can actually manage it or reverse it? Your health is in your hands. So you need to decide whether you will be able to manage it through just food, or you need some add-on supplements so that you prevent the consequences. So the three components of you need by which it can be explained, and this is the correct way. Because whenever a mother goes for antenatal checkups and she's not been consistent with her vitamins, the ones that are given, usually there is something called antenatal vitamins that are given to the mother that consists of this B6, B9, B12, etc. Now if the mother has been very inconsistent with it, the mother needs to know that she's feeding two lives. It's not just for her, it is for the child as well. Now when there is a deficiency of these nutrients for the mother herself and she cannot provide it for the child, there are certain issues, developmental disorders that happen in children. Are you all aware of any developmental disorders in children that happen? There is something that is associated with the spine of the baby. Yes, for the new baby. So what exactly is the issue? What are you aware of? Anyone here? What do you think will happen? Yes, folic acid deficiency in the baby. Yes. Are you all aware of Spina Bifida? What it is? Okay. So usually Spina Bifida happens whenever a child that has had a B12, B9 and vitamin B6 deficiency in the mother, the spine kind of is underdeveloped, but it is protruding through the back. And this usually happens when the mother is very careless when it comes to her antenatal vitamins and it is not reaching the child. So this actually puts the child at risk. So the mother during pregnancy needs to take care or tell herself that it is not just for her, but it is for the future child that is growing inside her. So adequate nutrition should be provided for both. So now infants who are well nourished in the womb, because how does the child get the nourishment? Through the placenta of the mother, right? So they have a good physical and mental health as well. Okay, that's why during this stage, mothers are asked to eat more of white butter and omega-3s and all of that, if you want an intelligent child and all of that. So this is true, because all of these nutrients finally they pass on to the child, right? So the nutritional demands are highly increased in the adolescent pregnant mother. The amount of protein that is given is 30 grams more than what a normal adult mother needs. And even the calories that are required is 300 to 500 calories more, because again, the growing child. And as per the trimesters, when we talk about the first, second, third trimester, the weight needs to keep going up. What happens when the weight doesn't increase at all? That means the pregnancy is not progressing properly, which is why there is always a certain weight category for every trimester, or a milestone that a mother needs to reach in every trimester. Okay, so yeah, yes, absolutely leads to a malnourished baby. So now lactation also, what happens is, now that the child is born, right? But even so, the nutritional demands during lactation, they are more than that of pregnancy. But why is that? Because the mother needs to provide the child with the breast milk. But now, if a mother is undernourished or is malnourished, the mother won't be able to provide it. And through the breast milk, also there are nutrients that are still passing, right? Now, during this time, if the mother is allergic or she herself has certain intolerances, she needs to make sure that those foods are not there in the, in her diet, because that will further pass on to the child anyway. So it does confer that on the child. Okay, so inadequacies in her diet will both affect the quantity and the quality of milk. So physiological changes in pregnancy, usually there is changes in body fluids, the body volume and the plasma volume, right? It increases. Why? Because there is an added, growth that's happening inside the womb. So there is also a pressure that is put on the gastrointestinal tract, which actually causes a lot of heartburn and gastrointestinal issues in the mother. There is change in weight, of course, which is required as and when the trimester progresses. So nutritional requirements during pregnancy and lactation, you can see the first trimester, second and the third trimester, see the energy increase. 350 calories per day in the second trimester, third is 500. Okay, and lactation during the first 6 months, there needs to be an increase of 600 kilocalories per day. So if a mother, normal adult mother, is consuming, let's say 1900 or 2000 calories, you add on another 600 calories, it goes up to 2500 calories on an average for a mother that is breastfeeding. Okay, then protein, of course, is important when it comes to pregnancy and lactation. Visible fat and essential fatty acids. Now, essential fatty acids is very important, not just for the mother, but also even for adults as well as children, as in when they're growing up, because essential fatty acids are not only for the brain, but also for the skin. They prevent any skin allergies and skin inflammation. Okay, so omega-3 family, they contain ALA, which is alpha linoleic acid. You even have supplements of ALA that can be taken post-workout. Then you have EPA and DHA. A lot of these omega-3s capsules, you will see it has EPA and DHA both. EPA is eicosapentaenoic acid for the heart, DHA is for the brain. Okay, then you have calcium, iron, iodine, zinc, vitamin A, basically all water soluble and fat soluble vitamins and minerals are required, especially when it comes to the intake of folate, vitamin B12, vitamin C, etc. Okay, so there are certain issues that happen during pregnancy, like nausea and vomiting. There is heartburn, but there are some issues that are very rare. There are certain health issues called gestational diabetes, that is diabetes caused by pregnancy. There is something called preeclampsia, so that usually happens. High blood pressure also because of a pregnancy. There is something called excessive nausea and vomiting that happens in food. Then there is heartburn, there is constipation, right? Then the diet and feeding pattern usually during lactation meats, poultry, fish, beans, eggs, of course, for those who are non-vegetarians. But otherwise, you have lean, you have legumes, you have. Nowadays, every team, every sports team has their own nutritionist, has their own physiotherapist, because this is important in order to prevent any fatigue, any unwanted health issues, and any unwanted, nutrient-related issues in the sports personnel. But there is a very important, reason also, because they need optimal sports performance. Now, sports nutrition is always directed towards sports performance in order to make sure that the person performs at its optimal capacity. Brain and coordination becomes very important, which is why food or nutrition becomes important. So, when it is well planned and strategized and divided in the day, it becomes very crucial. So, introduction to sports nutrition usually talks about these facets. Okay, so now we are going to talk about the tripod of fitness first. Tripod is nothing but having three sports. So this is exercise, nutrition, and rest. Then you have energy systems we are going to talk about. Energy systems is nothing but how your body utilizes certain aspects in order to produce ATP, which is in the end the energy that your body needs to exercise, because you do need energy to exercise, right? So energy system is involved in that. We're not going to go into deep the cycles and all of that. I'll just explain it to you in short. Then you have types of exercise. Then you have pre and post workout nutrition, which is as important as your exercise itself. Then you have supplements, which again are divided into two parts: the ones that you need for, if you're deficient, and the other is ergogenic aids, which is used for optimizing your exercise or your performance. All right. Now, introduction to fitness. We all know it is the condition of being physically fit and healthy, and sports nutrition is the practice of nutrition to improving athletic performance. Okay. So now, whether you are just started out, you're maybe gymming, but you're a professional athlete, or you're a bodybuilder, or you're just exercising to improve your health, sports nutrition becomes very important, because if you have a certain goal, whether it's weight loss, weight gain, weight maintenance, unless you know how your physical activity will go with the right foods, it is of no use. Because exercise without nutrition is like, a building with no good foundation. It is going to collapse anyway, right? No matter how it looks good from the outside. So you need to make sure that you complement your exercise routine with proper nutrition. So, what exactly is the aim? To peak the performance by providing energy-rich foods to perform activity. Your macronutrients are a source of ATP, right? Because they provide you with energy. You need to sustain the intense training. It's not that apne do din, you exercise like really heavy and then you're just tired and fatigued and now you don't want to exercise for the next 4 days. It's not possible. So for sports people or athletes, they need to sustain it. So it needs to be chalked out. Do you know, right before a marathon, the amount of carbohydrates or proteins that are taken is in a certain cycle, in order to make sure that by the time they reach marathon, they have enough stores. At the same time, they can sustain the entire marathon, right? The energy system is different in marathon's case, but a person who's probably weight training is just doing deadlifts, which hardly takes about 10-15 minutes. The energy system in that case is also different, what they utilize. So quick recovery from injuries. Injuries do happen in case of athletes, especially people who where the joints are always needed to be mobile. They need to make sure that at least we at some point can ignore certain nutrients or vitamins, minerals, etc. They can't do that, because if they do that, they are more prone to bone density related issues, which is why you'll see women who are usually in sprints, they're more prone to bone related, joint related problems. Because in women, why am I saying women, is because women post 30 are anyway prone to a low bone density. Okay, so they are more prone to bone related issues, especially athletes, when we talk about them. Okay, so body composition. What exactly is your body composition made of? Has any of you ever got a body composition analysis done? Have you seen what all does it contain? When we talk about weight, we're not just talking about the fat that you contain, right? We're not just talking about the muscle that you contain. We're talking about a lot, many things inside your body. So your body weight is comprised of a lot of other things like your fat and your fat-free mass. So your fat mass is, of course, the mass that contains your fat or the adipose tissue. But when we talk about the fat-free mass, it is many other things. It is your bones, okay, your muscles, your tissues that do not contain the fat, including your, you have your the fluid that is contained in your body. Okay, all of that comes under the fat free mass because that also is consisted in your weight, right? So your weight needs to be checked in terms of your body composition analysis as well, because sometimes BMI is not always a a testament of good health, because a person can have a very high muscle mass but a low fat mass and a high bone weight and still show a higher BMI for their height, right? So does this person, for example, just take bodybuilders. Now they have a very high BMI sometimes because their muscle mass, their bone weight, their density is really high, but their fat mass will be well within the range. It will be somewhere around 15%. So that does not make the person unhealthy, right? Similarly, if a person is, underweight, but it's because their muscle mass is, they are of a lean weight and their fat mass is low, it doesn't mean that they're unhealthy. But again, BMI kyun dekha jata hai is just to find a range of an ideal body weight, but what is more important is your body composition. What are you comprised of? What is your percentage? Uske hisab se aapka fitness score decide hota hai. So the better the graph of your muscle and your fat and your overall weight, the higher is your fitness ratio. If you ever go to any gyms, certain gyms have these machines. Now we have Penita. There are many other places they have body composition analysis from different companies. So you can opt for, just getting it done so that you understand what your body composition analysis is like. So targeted body fat, when we talk about normal, not athletes, when we talk about usual adults who are not athletes, males ke liye, we say it should be less than 20%. Women ke liye, it should be less than 25%. But now when we talk about athletes, it is slightly lesser. So for males, we aim at less than 15%, while women, we aim at less than 20%. Okay, there is something called visceral fat. It is surrounding your organs. Visceral fat is very essential because when you go below the necessary fat, it can cause easy damage to your organs. Okay, so that's why your body needs some amount of fat in order to absorb the shock or absorb the injury. So fat is nothing but cushioning, right? This is what we know. It's insulation and cushioning and padding. So fat minimum is important, but making sure that your essential fat is around 3% in males and 12% in females is important. When you go below that, what happens? It results in ill health. And I'll give you an example. There was this bodybuilder who had aimed at keeping his, the essential, his visceral fat, it went down to 0%. His entire body, the system just shut overnight and he passed away. So this is how important it is to maintain some amount of fat in the body, some amount of essential and visceral fat in the body. So make sure that you bring down your fat percentage, but of course it's not very low as well. So your fat-free mass includes your bone, water, muscle, organs, and tissues. It is also known as lean tissue or lean body mass, which should be higher than your fat mass. Okay. Water makes 60 to 70% of your body weight, which you already know, and all of this makes up your body composition. Now, body types, all of us know that what is our own body type. Now, there can be ectomorphs. Ectomorphs are people who lose weight easily. Jitna bhi khate hain, unka weight gain nahi hota. I am one of them. Okay, so ectomorphs find it very, very difficult to gain weight. They need to make sure कि जितना वो खा रहे हैं, they need to at least make sure that they increase 700 calories, 5 to 700 calories more and persistently on a daily basis, right? So it's not that they don't eat, it's just that they eat, but their metabolism is very high. Okay, so now when we move on to a different body type, we come on to the mesomorphs. Now these people are very lucky because उनका weight almost maintain रहता है. They're not people who gain weight also easily. They're not ones who lose weight also very easily, but their metabolism is kind of consistent. So they need to maintain a certain macronutrient ratio, but they will be able to sustain or maintain their weight. Endomorphs are the other spectrum. So agar ectomorphs find it difficult to gain weight, endomorphs find it difficult to lose weight. And in this case, they gain weight faster because unlike ectomorphs, जिनमें metabolism काफी high होता है, endomorphs में the metabolism is actually low. So over here, the chances of gaining weight are faster. They lose weight, but there is a yo-yo effect wherein they gain weight also that quickly. Okay, so ectomorph, endomorph, and mesomorph are the three main types of body or the body types that we talk about. Now, on the basis of this also, the goals are set. And if a person who is underweight comes to a nutritionist and says that on the basis of exercise, they want to gain weight, तो उस हिसाब से उनका protein, calories, and everything is calculated. Okay, so this becomes an important understanding in order to set goals, even as per exercise. So goal setting needs to be smart. It needs to be specific. So it needs to be defined properly. It should be measurable. Measurable क्यों? So that at the end of every 15 days or 7 days, you can measure it properly so that you know that you're progressing. Whether you're just exercising and you're just doing your own thing and then suddenly you realize that, it's not working out for you. So you need to measure it at certain intervals to see if you're at a proper progress. Because let's just take example of a person who's trying to lose weight. Now he's working out, he's losing weight. He's seeing he's losing weight. But body composition analysis एक महीने के बाद कराया and he sees he's losing more of muscle than fat. So that is not going to help him, right? So it's very important to measure this progress. Attainable. It needs to be, big goals need to have small steps to reach it. So it needs to be attainable. So keep small goals instead of just large goals. Then it needs to be realistic. Now, I can't say that I need to gain 10 kgs in a week. It's not possible. I won't say it's impossible, but then it's not. Remember, I told you protein is a thermogenic people who are into weight loss, but it's not something that has any side effects. Then you have ALA. Do you remember what is ALA? It is one of the essential omegas, right? So ALA is alpha linoleic acid. It helps in excess absorption or it helps in the passage of fats into the cells easily. Okay, so that there is no excess storage of fat. So ALA is one of the pre-workout vitamins. Then you have pre-workout meal options. So you can go through them. If at all you need ideas for pre-workout options for your meals, here they are. So at least 45 minutes to an hour before, especially if you're having a complex carb. Usually, if it is a high intensity activity, let's say you're doing some weight training, an hour before your exercise, if you consume a complex carb kya hota hai? You're studied in macro, it provides a steady release of glucose into the bloodstream so that your energy is sustained throughout your high intensity activity. So you can take cereals, pulses, etc. an hour before, not after that, because if you take just a few minutes before exercise, you won't be able to digest it and you will feel very queasy. So make sure that it is a proper time frame. Post-workout nutrition usually involves protein and carbs, and I've given certain examples of meals as well. So foods to eat after your workout, the kind of carbohydrates, the kind of protein, the kind of fat, and sample post-workout meals for you. Okay, so this is something that you can look at. So the purpose is, of course, to supply energy, to trigger replenishment or recovery, to spike up insulin and trigger the uptake of protein, because insulin is an anabolic hormone that's produced by your body. So it helps in making muscle mass. Okay, so quality, of course, you can decide on the basis of the kind of exercise that you're doing. And post-weight training proteins need to aid in muscle repair and recovery. Quality needs to be a first class or a high class protein, right? Or secondary proteins can be combined together, just like one of the meal options or a few of the meal options that I've given. Timing, like I said, 30 to 45 minutes, post-workout meal options, fats, antioxidants post-workout. Okay, so post-workout, omega-3s help in reducing inflammation and soreness, especially for people who are prone to having a lot of soreness and inflammation during exercise. You can take omega-3 supplements after workout. You can couple it up with some vitamin C and vitamin E as well. Although vitamin C can be taken on a daily basis because it is a water-soluble vitamin, you don't have to take vitamin E on a daily basis. For some people, vitamin E also helps in reducing abdominal fat. Okay, so vitamin E can help in both ways. But zinc, selenium, chromium, vitamin A can be a multivitamin taken post-workout. Okay, so what exactly is the whole funda between supplements and whole foods? Are they mandatory? Are they required? Not necessarily, because supplements are of two types. Now, one is if you're deficient, and like I've mentioned time and again, if you're deficient, you need the supplement, period. You cannot, compensate that lack with food. But certain supplements that are used as an add-on or an ergogenic aid. You must have heard of whey protein or, having things like BCAAs during workout. Then you have pre-workout drinks, like, that helps in raising your energy. There's also arginine and all of that. So you don't need them as such. They are not, of primal importance to your exercise itself. This is only for people who are into professional workouts and, they have it as a career, let's say bodybuilding and all of that. You don't need these ergogenic aids. But certain things like BCAA, even if you're not a professional athlete, will help you to an extent. Okay, so ergogenic boosts to body's performance. Even for those in sports, it does help them. Also over here, make sure that if you have issues with caffeine intolerance, avoid any pre-workouts, avoid taking caffeine before your workouts, because they are also used as aids or requirements in order to maximize your workout performance. So all of these need to be taken into consideration when you are chalking out your pre and post workout needs. So who needs supplements? Usually when there is inadequate intake. Of course, in some cases, when it comes to vegans. Now, I won't say vegetarians are more prone. Vegans are more prone to deficiencies like vitamin D and vitamin B12. Vegetarians can still maintain, if at all they take care of their diet well, because certain nutrients like vitamin D and B12 is only there mostly in predominantly non-vegetarian items. Missing meals, hectic schedule, travel, busy all the time, maximum meetings. So here you will need supplementation, especially if you're deficient. So supplements or fortified foods may be appropriate in some situations, like certain stages of life, whether it's pregnancy or lactation, adults that are 50 or older. So certain vitamins and minerals and whey protein could be complementary. Then adults aged 65 and older who needs to increase vitamin intake. So either a daily intake of 1,000 units or weekly of 60,000 units or once in 15 days of 60,000 units should suffice. Okay. So all of these are the do's and don'ts in sports nutrition. Okay, let's move on to clinical nutrition. So clinical nutrition is a very long chapter, but I am going to concise every health issue so you will understand it better. Because anyway, if we go protein wise, fat wise, you will get very confused because every disease has subtypes in them also. So you will understand it better if we understand every disease as a whole. Okay, so I'll list down the types also so you will understand it. Okay, here we go. Now, why do you think clinical nutrition is important? Let's just take one question and then I won't ask questions because we are anyway short on time. Why do you think clinical nutrition is important? For whom is clinical nutrition important? I think everyone are tired. Okay. Any one answer, chalo. Health conscious people, okay. Health has health has already grown critical. Yes, absolutely. Okay, so clinical nutrition, these are right answers. Clinical nutrition is also known as therapeutic nutrition. In certain conditions where a person is already having maybe minor deficiencies or issues wherein the person needs certain nutritional support in order to correct those deficiencies or minor health issues, infections, etc., it can apply. Also, like Mr. Ashok said, in certain critical stages, whether a person is not even able to eat properly, maybe post surgery or pre surgery, maybe this person is aging and has already contracted certain diseases, liver diseases, or simple things like even diabetes or hypertension. So all of this requires therapeutic nutrition, because this is clinical findings based nutrition. On the basis of the clinical findings, there is a nutrition chalked out in order to provide you optimal health or correct your health issues. Okay, so your clinical nutrition is nutrition of patients in need. So it includes management of outpatients at clinics and also inpatients in hospitals. It could also mean that you are a person with minor deficiencies and you want to correct them, so that you don't have to be actually admitted as such, but this is clinical nutrition. So now let's talk about what exactly could be the major diseases or health issues that we talk about. So you have anemia, diabetes, liver-related issues, heart-related diseases, cancer, genetic disorders, hypothyroidism, or thyroid-related disorders. Then you have kidney diseases, PCOS or polycystic ovarian syndrome, food allergies, and infection. Now, when we talk about anemia, let's just go one by one. When we talk about anemia, there are different types of anemia. When we talk about anemia, what's the first thing that comes to your mind? That is deficiency of iron, hemoglobin being on the lower side. But now there are many types of anemia, right? And the treatment and the kind of diet will depend on the type of anemia. Certain kinds of anemia, like iron deficiency anemia, or any for that matter, if we talk about anemia as a whole, there are certain clinical signs. You know, the doctors always check the insides of the eye. If it is pale, your skin, if it's pale, weight loss or sparseness of the hair. So these are clinical signs of anemia, even the nails for that matter, even irregular heartbeat, etc., shortness of breath, dizziness, feeling tired, fatigued very easily. So usually that is correlated to anemia. But now, since there are different types of anemia, there are different nutrients that are responsible for it. We always think it is iron, but there are other nutrients also that play an important role, like vitamin C and B12. There is a type of anemia called iron deficiency anemia. Then you have pernicious anemia that's caused due to B12 deficiency. That if your vitamin C is also low, the absorption of